You know, these last 2 or 3 years have produced a lot of tangents and a lot of weird things in chiropractic and a lot of poverty. Frankly, there's a lot not making it, not doing it well. And it's because of decisions that have been made that are not correct. There are some things, you're good at getting the body well. And I wouldn't expect you to know this, but we're good at getting the business well, good at getting your practice well. And just as you sit down with patients and you tell them there are some things they must stop and they must start, I want to do the same thing with you in getting your profession and your practice well. Some things have to stop. And one of those things that must stop is we've got to stop being illegal immigrants of healthcare. And what that means is, we can't look like we came from the underground somewhere. Students, when you graduate from chiropractic college, you've got to change then from you aren't a student anymore. So let's take it right from the beginning. For instance, because when I talk about illegal immigrants, what do I mean? I mean, we have to look like we're number one in healthcare. We have to act like we're number one in healthcare. We have to talk like we are number one in healthcare. We act as if and we become that. And once we act as if, then it happens. It doesn't happen just because you are granted it by the government and you're waiting for the Congress to do this for you. It isn't going to happen. So let's take an example. The outside of your clinic, it's got to be number one in healthcare. It's got to be class. It's got to look great. I drive by a lot of chiropractic clinics that I wish that they would change the name and they would call it a dentist office or an optometrist or something. Anything but chiropractic, because it doesn't reflect, number one, it doesn't. Even the signs, you drive by at night and there'll be signs where a bunch of light bulbs are burned out. Before you know it, you look at it and it says Chiropractic or something like that. I mean, what is the deal? Maintain it. Keep it beautiful. Make it number one. And when they walk in the inside, it's got to be the same way too. It can't be all bunged up. It can't be some sort of poverty-stricken office there. It's got to look and be first class, because if you want to be number one, you got to look number one. And it goes through to the dress as well. Let's take your staff and let's take you. You understand, even at our conferences, we have a dress code. And the reason is because even when you come to the hotel, you're representing chiropractic. We've got signs out that says this is a chiropractic meeting. And therefore, anybody who looks on is going to know that they are chiropractors. And I want them to see the best of the best. I want them to see number one. I want them to see class. I want them to see professionalism. And there's got to be a professional look of the staff, a professional look of the doctor, and a professional look of that clinic. And if that professional look isn't there, believe me, they won't believe that you're number one. People listen with their eyes. They are looking, and that's what causes them to believe. If you were to step on an airplane and you were to look into the cockpit and there's two guys sitting there with blue jeans and t-shirt on, you'd be thinking, where's the pilot? You're looking for those gold bars around the sleeve and the coat and the cap. You're wanting to see that because I'm telling you, there's a professionalism that you expect for somebody who's going to take your life into their hands. And when those patients come in, there are some that you could look any way you want and it wouldn't bother some people. I admit that and I know that. But I'm not interested in just getting 8% of the population. I'm interested in getting 80% of the population. And there's a whole lot of the population that don't want to come to somebody who looks like they're getting by. Who don't want to see an office that looks like it could close at any time. If you don't pay attention to detail and if it's dirty and all that, what does that mean that you do with their medical records? You're communicating all the time. So you have to realize, if we're going to be number one, we've got to start with that look and that professionalism. We can't look like immigrants. So, students, when you graduate, you're not students anymore. You can't look like students. You now got to look like the number one doctor in your community and the number one doctor in healthcare who knows how to get the body well naturally. Let me tell you something. This is a must. It can't be that when patients walk in, you look like you're from Mars or Venus or you've been all, I see all kinds of things that are crazy. You can't get into that and you can't do it. We've got to be number one. My name is Keith Maule with Integrity Management, and we are going to take the profession to the top. And we want you to help us. If you want to help us, go to integritymanagement.com or savechiropractic.com and help us so that we can take chiropractic to the top.